Welcome to our week 9 review for ST200 Surgical Technology at Theory 1, Exercise 2. So in this session, we're going to be exploring key psychological or psychosocial and end-of-life care topics from Chapter 5 and Chapter 14 of our book. Again, our focus is not providing the answers, but guiding you to get to the correct ones. So let's begin. Question 1. What is the philosophy of Rogers' patient-centered care? How might a caregiver create an environment that supports a patient's emotional healing? What role do qualities like empathy and authenticity play in a care setting? How does the idea that the patient knows what is best shift our approach to communication? And what are the consequences of not honoring a patient's unique emotional experience? Refer to the section on humanistic approaches. And also think about this. How could this philosophy change the way you interact with a patient just prior to a high-stress procedure? Question 2. What does Maslow's chart teach us about the needs of individuals? What basic needs must be met before someone can focus on emotional or spiritual concerns? How does this hierarchy help us to prioritize care in a surgical setting? How might a patient's place on the pyramid change preoperatively versus postoperatively? And are there ways that we as surgical staff can support the needs beyond the physical? Check out Figure 6.1 in Chapter 5 to examine the structure of Maslow's hierarchy. Question 3. Why would a patient feel a loss of security before surgery? Now, what are some physical threats a patient might actually fear? How could psychological stress affect surgical outcomes? What can cause a patient to feel powerless or vulnerable? And how does trust in the healthcare team contribute to a feeling of safety? Explore the section discussing psychological response to hospitalization in Chapter 5. And think of this. What actions can you take as a certified surgical tech to help reduce a patient's pre-operative anxiety? Question 4. Why is self-image important to a patient before surgery? How might illnesses or surgery affect how someone views their role in life? What connections exist between self-image and physical capabilities? Why might a patient grieve the loss of their normal routine or identity? How does social belonging play into a patient's emotional well-being? Review the discussion on identity and psychosocial impact. That's also in Chapter 5. And think of this. If a patient expresses, let's say, fear about losing independence after surgery, how should you respond? Question 5. What does a therapeutic support when it comes to patient communication include? Think about, what does active listening really look like in a high-paced clinical setting? Why is it important to offer clarification, not just information? And how do we balance assurance with honesty? And what does a patient need most when they are just emotionally overwhelmed? Turn to the communication strategies listed in Chapter 5. And here's something to think about. You notice a patient is unusually quiet after consent is signed. What could you say or do to support them? Question 6. List effective ways of communicating with the elderly patient. Why should we avoid using pet names or condescending tones? What verbal and nonverbal cues might show respect? How can we address these concerns without rushing? And how does proper name usage reinforce dignity? Look at patient-specific communication guidelines in Chapter 5. And how would you be different when preparing an elderly patient versus a younger one? Question 7. Explain developmental disabilities and how it affects communication. Think about this. How might communication styles need to be adapted for patients with cognitive delays? What assumptions should you avoid when interacting with these patients? How does your language show respect and individual dignity? And what team communication strategies are so important here? Explore the section on special populations in Chapter 5. And here's a real-world application to think about. You're assisting in a case with a developmentally delayed adult. What considerations affect your patient interaction before anesthesia is administered? Question 8. What are some common fears of patients before or prior to surgery? Think about this. What unknowns might patients worry about the most? How might previous experiences shape their current fear? How does fear of loss, control, privacy, identity manifest in a surgical setting? And what visible signs of fear might you observe? Review the section on emotional reactions to illness, again in Chapter 5. Also think of this. A patient jokes nervously about not waking up. What could that be masking? And how do you respond? Question 9. From a medical point of view, the end of life is. Now, what signals indicate that the dying phase has begun? What's the distinction between comfort care and curative care? How should care priorities shift at this stage? And how does clarity about prognosis help with decision making? Read the opening section of Chapter 14 discussing the medical definition of end of life. Also, how might your role in the operating room change when working with a terminal patient undergoing palliative surgery? Question 10. The term brain dead refers to. Now, what distinguishes brain death from coma or a vegetative state? Why is this diagnosis legally and ethically significant? What medical support can be maintained during brain death? And how does the definition affect organ donation protocols? See the section on definitions of death in Chapter 14. And think of this as well. If a patient is declared brain dead in the operating room, what role might you play next as a surgical tech? Question 11. Blank is the right of every individual to make decisions about how he or she lives and dies. How does patient autonomy relate to treatment consent? What boundaries exist between patient wishes and medical recommendations? How might culture or spiritual beliefs shape a person's choices? And what legal documents support this right? Search for the patient's right and self-determination in Chapter 14. And how would you handle a situation where a patient's advance directive conflicts with their family's wishes? Question 12. Describe the difference between a living will and a DNR order. What level of specificity does each document provide? Who might be involved in decision making if the patient is unable? How do these documents reduce ambiguity during crisis? And what ethical issues arise when there is no documentation? Look into the end of life legal considerations in Chapter 14. Now, during a code, you learn the patient had a DNR, but it's not in the chart. What should happen next? And the last question is a scenario. You are called in for an XLAP. Upon arrival to the hospital, you learn your patient has a ruptured aneurysm. You prepare the operating room and scrub. Then notice the patient is brought in and is not breathing. The surgeon makes the incision and the abdomen is filled with blood and your patient crashes. After a very brief silence, your patient dies on the table. First question that's going to be asked, what is your role as a surgical tech at this point? What duties must be filled even when a case ends in death? How does the ST help preserve dignity in death? How might routine closing protocols still apply? Procedures for surgical conclusions are discussed in Chapter 14. How would your tone and body language shift during post-mortem prep? Question B. The patient's family wants to see their family member. Who stays with the family? What roles do physicians and nurses play in this moment? How can you offer subtle support without overstepping? What environmental details should be managed for the family? Consider communication protocols, also in Chapter 14, and think about how you can provide respectful assistance without engaging in counseling. Question C. What is the ethical thing to do with this patient? Think about how beliefs and culture affect decisions after death. Why must personal wishes be validated in end-of-life care? And what makes ethics different from protocol? Review ethical dilemmas in dying, also in Chapter 14, and think about what ethical dilemma might arise if the patient's wishes are just not known. And D, do you remove all cords and clean the patient up before the family visit? Why? What circumstances require everything to remain in place? Who determines if a case is a coroner's case? And how does post-mortem appearance impact family grief? Make sure to check out post-mortem procedures in Chapter 14. And think of this as well. How might you explain cord removal or lack thereof to a new team member unfamiliar with the policy? All right. Thank you for reviewing the week 9 exercise 2 with me. The psychosocial and end-of-life challenges we've covered are some of the most humanizing elements of our field. As you study, I want you to remember, it's really not about memorizing these answers. It's about understanding what kind of surgical tech you want to be. Keep using your book. Ask thoughtful questions and engage deeply with each patient experience. With that, see you in the next session.